So obviously there was a report from Shams Charania earlier this afternoon that Joel Embiid has a displaced flap in the meniscus in his left knee. Shams then correctly went on to describe that, when you talk to surgeons, this is a tear. So they have that they're working on, and basically that they are trying to decide whether to play through it or to go through surgical rehab. Kyle spoke to an orthopedic surgeon, Christopher Selgrath. Go to allphly.com, check that out. I believe it's right up at the top of the page. But basically, the orthopedic surgeon there, because when you start talking about surgeries on a meniscus, there are really three options. The non-surgical one, which is rehab, give it 6 weeks, see how it feels. And the guy Kyle spoke to basically said this is their preferred initial suggestion. Just now, sometimes teams or players don't want to do that because if you spend the 6 weeks, you can't really predict whether or not that rest will be enough.
For an average non-professional athlete, that's the
recommendation, right? But for a professional athlete, you can't predict whether or not it will recover. So a lot of times they will just opt for surgery just so they have a better chance when the 6 weeks are up that they are ready to go. So the two surgery methods, one of them is sort of like a repair, and that, according to this doctor, is only available on very infrequently, actually. A low percent of chances can actually be repaired. That would be a much longer recovery, like a 4 to 6 month recovery, would have a better long-term prognosis. But a lot of them can't be treated or repaired like that. So the next surgery would basically be like a removal of that section of the meniscus. That tends to be like a 4 to 8 week recovery. But you're removing a part of the meniscus. That is not going to be as effective as a shock absorber down the line. So it sounds like, it basically sounds like either he tries to play through it, rest and then play through it, or have that surgery where it's going to be like a 4 to 8 week. We're still waiting for confirmation exactly on that. Nick Nurse spoke before the game, didn't have any update whatsoever, wouldn't even really confirm that report. So we are still in a waiting pattern to find out for sure, but it sounds like it should happen here in the next 24 to 48 hours. We'll have some kind of decision.
And for people who thought that Joel could be out for the entire season, just reading, the doctor that Kyle talked to, and then I think Jeff Stotts on Twitter, who's another kind of a big NBA injury go-to follow, they made it sound like that's oftentimes in this case. Now, they don't have all the info, but a lot of times in this case, that's not really an option, the repair, the out for the season move. So it's a question of whether you want to go the rest route, which I think is preferable here, but like you said, you don't know if it's going to work.
Right. The concern with the rest is he rests for 4 weeks, comes back, maybe plays well for a week, but then starts experiencing pain and swelling. And again, the guy Kyle spoke to said that, like, you might be able to say there's a 70% chance that you won't have any flare-ups after the rest, but it's hard to predict beforehand if you're going to fall in the 30 or 70%. So it's a little bit unpredictable. So a lot of times athletes will elect to get the surgery in part because that is a more predictable recovery period.
But like you said, the downside to that is you remove part of your meniscus, and that could be complications both down the line in his playing career, but also down the line in his life as well.
Yeah.
So
arthritis. Yeah. There's all kinds of stuff that could be a complication from this. Now, another key aspect to this is he already had surgery on the meniscus in his left knee back in 2017.
Remember when he was dancing at the concert?
Yeah, it wasn't a great look.
Yeah.
It wasn't a great look.
It was the first not great look and a lot of not great looks for this organization
especially because at that point they were still calling it just a bone bruise.
Yes.
But that is a complicating factor because that's just like if they remove 10% of that meniscus back then, remove another 10% here, that's not great. And that's not great for Joe, the basketball player, but that's also not great for Joe, the human being, for the rest of his life. So this is a tough decision for sure.
But it does not seem like, at least reading this info, that he's going to be out for the year. I think they're going to, at least right away, like they're going to try the rest route or how do you say that? The meniscectomy?
Yeah, that's a good attempt for sure.
Yeah.
I don't know if I've ever said that word, but it sounds right.
I've read it a bunch.
Yeah, too much.
A lot of YouTube doctor stuff going on. Got a lot of find your own facts going on right now. But unfortunately, that's when the Sixers, I mean, their injury designation at the beginning was so weird.
Yeah.
Like,
Well, it's been weird for a month.
lateral meniscus injury. Yeah, and that's on the heels, like you said, of like knee soreness. And
Yeah, you can't just say knee soreness for 3 months or 3 weeks, 4 weeks, and expect fans to then trust you. Like, okay, tell me why the knee is sore and swelling. They never did it.
Well, especially because you have somebody like D'Anthony Melton, and it's like lumbar spine soreness. Like, it's as specific as it gets. And yeah, it's just, this has been completely shrouded in mystery.
They seemed very hesitant to use the word tear throughout the last couple of days. I don't really know why. Like, when you tell us it is a displaced flap, like, we can Google that. We can talk to orthopedic surgeons. We can get the YouTube doctors, like you mentioned. And quite frankly, you say that, but like, they're real doctors, and they all sort of came to the same conclusion. So like, we all have Google. Why don't you just? I don't know. It's weird.
You know what I've learned a lot on Google the last couple of days? Your meniscus tears a lot.
Yeah.
My meniscus, your meniscus, Joel's meniscus.
Mm-hmm.
Yeah. So maybe they shouldn't be so afraid of that designation.
Yeah.
Everybody's got torn meniscus. It's just, does it actually hurt?
Is
Are
it
you
symptomatic?
symptomatic?
Yeah.
Those type of things.
We all silly like the mayor.